Title: The Importance of Compassion and Support in Crisis Situations. Introduction. In our everyday lives, we often encounter people who, for various reasons, find themselves in difficult or dangerous situations. One such example can be seen in the story of Little Mama, a woman living on 7th Avenue who has become part of the community, even though she struggles with personal challenges. Her story is not only one of hardship, but also one of resilience, compassion, and the profound impact a little help and support can have in moments of crisis. This narrative reminds us of the vital role empathy plays, both in healthcare settings and in our day-to-day interactions with others. The power of compassion in crisis. Situations when the emergency medical team responds to a call about a patient with a rapid heart rate after being attacked, their primary focus is on stabilizing the individual and alleviating his anxiety. A fast heart rate can be a physiological response to stress, trauma, or drug use, which is why the paramedics ask key questions about his potential drug use or whether he might have been drugged. The aim here is not to make the patient feel ashamed, but to assess his condition accurately to ensure the right treatment. Research supports that anxiety and trauma can cause elevated heart rates, and addressing this requires a combination of medical intervention and emotional support. A study by the American Heart Association highlights how emotional distress can trigger physiological responses like tachycardia, underscoring the importance of calmness and reassurance during medical emergencies. By helping the patient breathe deeply and slowly, the paramedics assist in reducing his heart rate, showcasing the impact of compassion on physical recovery. This encounter also illustrates the complexity of trauma. When people experience violence or abuse, their emotional state can have lasting effects on their physical health. In this case, the man's elevated heart rate is likely due to both the physical altercation and the emotional shock of the event. Trauma-informed care, which takes into account the emotional well-being of patients, is crucial in these scenarios. Health professionals often have to balance physical care with psychological support to ensure a patient's overall well-being. The role of community support. As the paramedics attend to the patient, we see the introduction of Little Mama, a local who has earned the affection and concern of the community. Despite her challenges, she plays a significant role in the incident, even intervening to scare off the attackers. This act of bravery showcases the importance of community bonds. In many urban areas, individuals like Little Mama are seen as integral parts of the neighborhood, offering support to others, even if they themselves face adversity. The story demonstrates how individuals who are often marginalized can make a huge difference in the lives of others. It is essential to recognize that everyone, regardless of their circumstances, has the potential to offer help and support. In fact, community support is often a cornerstone of recovery, both for victims of violence and for individuals experiencing personal struggles. Research in community psychology suggests that social support networks can have a significant positive impact on mental and physical health. In times of crisis, the presence of trusted individuals can alleviate stress and encourage recovery. Little Mama's willingness to intervene not only assisted in the immediate situation, but also contributed to the patient's sense of safety and emotional well-being. The psychological impact of violence. The story also brings to light the psychological trauma that comes with being a victim of violence. The man, after being assaulted, experiences not only physical injury, but also emotional distress, which is reflected in his elevated heart rate and anxiety. This highlights the importance of mental health care for victims of violence and trauma. Studies indicate that victims of violence often suffer from PTSD, depression, and anxiety disorders. The emotional toll of such experiences can lead to long-term health issues. According to the National Institute of Mental Health, Trauma-informed care is essential for addressing both the physical and mental health needs of individuals who have experienced violence. By asking the patient about his drug use and offering to help him with legal matters, the paramedics demonstrate a holistic approach to care, addressing both his immediate medical needs and his emotional and psychological well-being. This approach is aligned with best practices in trauma care, where medical providers not only treat physical injuries, but also help patients navigate the emotional aftermath of traumatic experiences. Conclusion. In conclusion, the story of Little Mama and the paramedics' response to a traumatic situation highlights the essential role of compassion, community support, and trauma-informed care in crisis situations. By combining medical expertise with emotional support, healthcare providers can help patients recover physically and emotionally. Furthermore, the narrative underscores the importance of community members supporting one another, especially those who may be marginalized or struggling with their own challenges. The takeaways from this story are clear. We must not only care for the physical needs of those in crisis, but also recognize the emotional and psychological toll that trauma can have on individuals. By offering kindness, understanding, and support, we can help others heal and rebuild, making our communities stronger and more resilient in the face of adversity.